Good afternoon. Welcome to Traditional Chinese Medicine. Today's show is on psoriasis and eczema. My name is Christina Kapothanasis. I will be your hostess for the day. I am a licensed acupuncturist here in the state of Hawaii, and I am a diplomat of Oriental Medicine under the National Certification Commission for Acupuncture and Oriental Medicine. I am also the Executive Director of the Hawaii Oriental Medicine and Acupuncture Association. Thank you so much for joining me today. I am going to go over Chinese medicine's view of psoriasis, eczema, and other skin conditions that Western medicine can't quite explain. I know that Chinese medicine puts a lot of skin conditions into similar categories, though Western medicine may differentiate specific diagnosis of. And even though they have several different diagnoses for the different skin conditions, a lot of the treatments are still coming back to prednisone and or topical steroid creams like cortisone. So until they have a better cure for it, I think Chinese medicine is a perfect alternative. In Western medicine, there's not an obvious explanation for why these diseases occur, but they know that it has something to do with chronic inflammation and possibly immune-mediated diseases or autoimmune kind of diseases. So traditional Chinese medicine looks at it in terms of traditional Chinese medicine theory, and we use words like blood and heat and wind. And so that doesn't exactly correlate to Western medicine, but the treatment methods can pair up very well. 1 to 3% of the population is affected with psoriasis and or eczema. So actually that's quite a large percentage of the population. And more women than men are affected by these skin conditions. In Chinese medicine, I have a very good explanation for why more women are affected than men. When we look at the Chinese pathology behind these kind of skin conditions, and it doesn't necessarily have to be restricted to eczema or psoriasis, but any kind of dermatitis, inflammatory skin conditions, I will include these all together. We say that a lot of these conditions have 3 elements in them. One is heat, one is dampness, and one is wind. That probably doesn't mean a lot to you, so let me try to explain what those are. So dampness is something like inflammation. It's a sticky condition that comes from poor digestion. So we know that we have something to do with the digestive system and poor digestion, just like when you get a cold and you have phlegm that comes out of your nose or your lungs, then this is the idea of dampness, but it can be in different organs inside the body. Heat is easier to understand when you eat a lot of chili peppers and you're in the hot Hawaiian sun all day long, then the body would get hotter and or more dehydrated. So this can happen from many stressors on the body, and food is a big stressor, but so sleep deprivation, in addition to the things that we usually think about being stressful, like work and relationships. So this is the next one. And then when the heat is extreme or there's some kind of dryness in the body, the third one is wind. So wind brings about, it's sort of the tipping point, and that is when the itchiness starts. So maybe your skin starts to feel itchy, and then little bumps come up, and then they break, and they bust, and they scab over, and they're dry, and they scaly, and et cetera, et cetera. So the dry skin, and especially the itchiness, is due to the wind. And we have to take the wind out, but how can we do that? We have to nourish the yin. And the wind usually comes, just like I use the analogy of desert. So in the desert, it's very hot, but there are no trees to break the wind. And so when the wind comes, it stirs up all the dust and the sand, and then we are irritated and the skin is irritated and we feel very itchy. Whereas in the less tropical forest, when the wind comes, the dust is not going to be all stirred up and we won't feel as itchy, but we will feel damp. So we have to see what of those three pathogens are the strongest in the body, and then we attack. So why do more women have these, or one or two or three of these kind of pathogens versus men? It's because it has to do with blood loss, or using up the blood faster than the body can create it. I see so many women who come in to the clinic and I ask about their history. They have a history of heavy periods, or they have a history of periods that are very close together. Periods should be every 28 days, but maybe they have them every 3 weeks, or they have bleeding every 2 weeks where they have ovulation bleeding as well. And the shorter your period is, the hotter you are. So then we have heat, and then we have blood loss, which is the number one reason that we get wind, because the blood is different than water. If you drink water, it's a very smooth and clear substance, whereas blood is thicker and it's stickier. So if you can think of coating something with water or coating something with honey or blood, it's just a thicker, more viscous substance that moisturizes better. So when women lose blood through heavy periods, heavy cycles, and or possibly childbirth, maybe they lost a lot of blood during childbirth, and only after that, after the breastfeeding started, then they started to get it. Why? Because they lost a lot of blood during childbirth. Some people also have different kinds of fibroids that were causing the heavy blood loss, or PCOS or endometriosis or some kind of gynecological condition. And that means not only do we have heat, but we also have dampness. So we can start to see how these things build up. And why do they build up over time? It's the stressors in the body, which I review with everyone. So those are the sleep deprivation, poor diet, too much or too little exercise or improper exercise, and then regular stress that we think of, the daily grind, and or environmental chemicals, which is maybe not as prevalent as these, in my opinion. So we try to help these people find out what their tipping point was. Was it too many years of heavy periods? And then, for example, this one lady joined the Army, and she was supposed to run several miles a day and do PT in the blazing sun, and there we had the blood loss, which had the wind, and then the heat, and that was her tipping point. Or the other lady that possibly had childbirth, and then after that lost a lot of blood, and ta-da, that was her tipping point. And we have to try to understand why, so that we can know the best solution. And when you lose a lot of blood, blood is contained in the liver, and then over time that will borrow from the kidneys to replenish. And then I see more often than not that the kidneys are associated with this condition. And as I was explaining in another episode today, that the kidneys are somewhat similar to the idea of adrenal fatigue. That's as close as I can come up with a good analogy. So you're going and going and going, and the body gives you a heavy period, and you may feel quite fatigued when that period comes on, but you keep going to work all day long, and you keep taking care of the kids, and you keep cooking and whatever other chores you have to do, and then you don't have time to replenish the blood. So it's going to pull on the kidneys, and that intense adrenaline that we have going all the time to keep up with all this, our bodies just can't tolerate it, and then over time we will get a symptom popping up here or there. And today just happens to be talking about one of those, which is the skin conditions. So we need to see the person's complete history. I ask questions from head to toe, their sleep, their bowel movement, their appetite, if they have coughs, if they cough up phlegm, if they have night sweats, if they are fatigued, what's their urine like, what's every aspect of their period like, from the color of the blood to how much they bleed to cramping, and etc. So then we can come up with a clearer picture of which of the 3 pathogens are highest in the body, and we will make that the strongest part of our formula. We do herbs and diet changes and acupuncture to help with this. And it all works very well together. It's very hard to treat. It's very hard to cure if we can't have all of them together. And I try my absolute best to help people completely cure. And if not, I will reduce them and alleviate their symptoms as best I possibly can. So the dampness can come from excess, or it can also lead over time to deficiency. Depends on how long the person has had the condition and how strong or weak their constitution was when they started with the condition. So the dampness can be seen through usually a thick tongue coating. That's the telltale sign, so just stick your tongue out in the mirror, and if you see a thick tongue coating, you know, whoop, my dampness is more severe. And another telltale sign is the stools. So if we have loose stools, like they come out and fall apart like applesauce, or one lady described them as confetti or fluffy. Those are cue words to describe the bowel movements, and if they are fluffy like confetti, then you probably have dampness in your system. If you still have solid bowel movements, then it may be more of an excess dampness with thick tongue coating and or slippery pulse. And then if it's turning more into a weakness, you might have the loose stools and or your spleen pulse might be weak already. And that's where we really need to do tongue and pulse together with the symptoms. Almost always, people are going to have a lot of heat in their body, more often than not, especially here in Hawaii where everybody's hot. This is the hottest place in the world for Chinese medicine. I order almost all of the cooling herbs, and I can't keep them in stock fast enough to keep up with the heat and the syndromes that come in no matter what your condition is. It usually has a little bit of heat in it, 90% of the time here. So the heat exceeding limits until we get dry, or the blood loss, we can't nourish, and we can't keep ourselves cool enough because we're something like dehydrated, which cannot be fixed with water, unfortunately, and then we get heat again. So we need, for those people, we'll see a more red tongue, and these women will usually always have a little bit heavier of a period or shorter cycle. They may feel irritable, they may have hard stools, they may have loose yellow stools from the heat, and they probably will have slippery pulse on the left versus the right, because the left is the blood, and these people will probably be warm to the touch. You can test that. If you're warm to the touch, you press here and you feel warmer compared to the next person. And it's not just from being out in the sun, because here, maybe here you don't feel as warm. Then you know, oh, I can just put my fingers here and say, you're quite warm. So that's another easy way to tell. And then the people that have already had the heat so much that they've completely burnt off the fluids, or they've had so much blood loss that they've just gone directly to weak, they're no longer in the excess, their pulses will be very thin, but it might be like a little crouching tiger. The heat is deep, and it's just because there's so much heat that it's burnt off all the fluids, so their pulse feels like it's sort of tight and slippery but thin. And this one, they will probably warm to the touch too, and then you'll know that you need to give slightly more nourishing the formula than the other people where you can just flush out the heat. And depending on what stage they are in their healing and or in their condition, in their disease, we will be able to see the kidney or liver yin deficiency. When the pulses are super slippery, which is meaning that there's lots of heat and inflammation going through the body, and they're in a full-blown breakout, their pulses are probably going to be so expanded from the heat and plumped up that we might not even be able to see the kidney and liver deficiency yet. But once we clear out some of that heat and their pulses come down more to normal size, then the kidney and liver pulses will usually just go right to sleep. And I'll say, So what I try to do is right off the bat, I try to help nourish the kidney and liver yin, because I know that sooner or later it's going to go weak, and we try to get a head start on it. The herbs that we use for this condition only work well if we do the food together. The people with skin conditions I feel so sorry for because it takes a little bit longer than, for example, a person that comes in with a cold or even pain can sometimes be faster than skin because the digestive system has to heal first. But usually within a couple, 3 months, people can see a big difference. And 2 to 3 months for somebody who's been suffering for years is usually not that long of a wait. It just seems like it's a slow healing process when you compare it to a strong prescription drug like prednisone, which comes in and just burns off everything, all of the dampness, and makes you super dry. That is why it takes away the itching and the skin breakouts momentarily, because it usually comes back with a vengeance after you stop. Sometimes it doesn't, but sometimes if the person was really hot in the beginning, and it's just not a good idea to do that because it's not going to heal you, nor will it prevent future breakouts when one of those triggers come back because your constitution was not corrected. So we need to help the person heal, and if we do it together with the diet, that makes a world of a difference, because if we have a clean diet, that means we're starting to heal the digestive system, and the huge plus is you can absorb the herbs better, and that's what you need to heal the liver and kidneys. If you just do food alone, that's fabulous, you will feel better, but if you can do the herbs with it, that's usually the best chance we have to resolve this situation once and for all. I try to use, first and foremost, the kidney and liver herbs. So, I love to use Nüzenze and Hanniancao because they are the most gentle kidney yin building herbs. A little seed here and a leafy green here. And these two herbs are cooling and nourishing to the kidney yin. I also love to use guiban, which comes in powder form, and or bieja, because those are a little bit stronger. If we can't get it with the gentle ones, not stronger in side effects, but just stronger in effects. So we will put guiban on there as well, because not only building the kidney, but it can also build the blood and quell the wind. So this is an excellent one. And this is treating the root of the problem. Then we need to see how hot and or damp and or weak is the person. So to help them faster, we need to make sure that they stop itching. If we can get you to stop itching, then we know that we're getting there and we have the best chance for you to heal completely. So this little powder that's in this pouch is called muli. Muli is one of the best herbs for pushing down the liver, quelling the wind. And remember, the wind is responsible for itchy, so we try to cool you down. This is also very calming. It'll help you sleep better and stop that itching so that you can sleep through the night. These are herbs called fangfeng and niubangzi. These we can also use for the common cold. And when we talk about the common cold, as I actually did in the last episode, that is wind in the exterior. So when you have wind, we need to expel the wind. The easiest way to expel it is through the exterior. And though we would use these herbs for the common cold as well, they will be instrumental in getting out the wind from the skin for the eczema, psoriasis, and other skin conditions, and stopping the itchiness. So we have different ones that we can pick from, and today I brought 2 here for you. Ye Jiao Ten is excellent because it does many things. It's calming, which is always helpful for people who are itching all day long and worried about their skin, but it's also taking out the wind, take down itchiness, take out the dampness, excellent, and it is not hot, it is neutral. So this herb is wonderful for helping skin conditions. We just have to make sure that we use the appropriate dose at the appropriate time, because this can be a little bit dry. I always need to help flush out the inflammation. If their pulses come in super overactive and slippery and full of inflammation and heat, we've got to clear that down so we can see the forest for the trees. So xuanzang is my all-time favorite. I love using xuanzang because it cools the blood and it will cool the digestive system, but it also nourishes the yin and it is not sticky and damp. This is a beautiful herb. Then we'll use more nourishing the yin herbs like maidong and tiandong and shihu and beisasen, etc. And these will also help clear the heat, but not nearly as strong as xuanzang. And this one tastes excellent, and people call this gummy bears because it puffs up when you boil it and it looks like gummy bears, and I plead with people not to eat them, but that's okay. Then we have baihe. Baihe is another nourishing the yin. It's very calming, so we try to use this to nourish the yin and calm some of the itchiness. And then for the dampness, we see if the dampness can be taken care of with the food and these herbs, or if they are weaker and they're having loose stools, then we definitely need to strengthen their digestive system. And these cute little cubes of white are called fuling. There's another one that comes in slices. It's called fusen. And that one is not only going to help strengthen the digestive system and stop the loose stools, which will help with the dampness for the skin conditions, but it can also be calming. And the itchiness is just so irritating to people. I feel so sorry for them. And so I try to put as many calming herbs as I can in there. And this one will be an excellent one for the digestive system, as well as things like dangsen, which also helps build the blood and give you more energy while at the same time helping build the digestive system. People use baizu, but I think it's a little bit too dry for the people here in Hawaii. I love to use shanyao, which is yamaimo or mountain yam. People may know that here in Chinatown. And this is an excellent food/herb that is good for strengthening the digestive system. And then I can also use ganzao, which is licorice. It's excellent for detoxifying. So we need to get some of the heat and inflammation out. And sometimes I'll use this depending on people's blood pressure. We don't want to raise the blood pressure. And then I may use different herbs to cool the blood, like sandi or zicao or chisao, depending on the strength of their digestive system and or the level of dampness in their system. And then I will work with people with the acupuncture. So acupuncture, my favorite points for taking out the heat in the digestive system, the heat and the dampness, and cooling the blood, building the blood, and circulating the blood so you can make more blood would be chu chi here in the elbow, and shui hai, which is on the top of the knee here. So those are my favorite ones, and I tell people in between appointments you can also do acupressure. You just have to press in hard enough, like so, that you feel a little bit pressure right there. So this is acupressure, and you can use that on points like the chu chi here in the corner. Just press in till you feel sore, and on the inside of your knees. The bai hui point on the very tippy top of your head is excellent for reducing the wind in the body, as is feng shui or jiegu. You can use different ones. On the back, we can use points for the different organs. So fei shu would be excellent, and ge shu for getting out the wind, and ge shu right under the shoulder blades would be excellent for cooling the blood, boosting the qi, building the blood, circulating the blood. You can do liver and kidneys back here for the blood, and you can also do the spleen and stomach points if they have a lot of dampness in their digestive systems. And then we can also work with different cooling points like waiguan and hegu on the outside of the hand, or we can go to the digestive points down here along the outside of their calf. And then if they have spleen issues or liver and kidney, we might come down here on the inside of the calf. And the acupuncture is very relaxing. It helps take out heat. It helps strengthen your digestive system and take out the wind, which equals take down itchiness. And usually what happens is people's itchiness will go down, their flare-ups will get less and less and less, and then the skin will get pinker and not so red and irritated, and then slowly the skin will form over the new skin, and the peeling will, this peeled old skin will come off, and then it just takes longer for the pore scarring to go away. As long as, like I said, we can get the itchiness to go away or be extremely minimal, then we know, oh, we've almost got it. And you just have to slowly change the diet, fast enough that you get results, but slow enough that you're comfortable with it, because people with this condition just have a more delicate constitution than others, and they have to be careful with what they eat because food is medicine. So that concludes the summary of what I wanted to share with people today. We can also use cupping on people. Cupping can help take out the wind faster if we use it on the back. Sometimes when there's a lot of heat, we can use bloodletting. Our needles that we use are so fine. They're teeny, tiny, tiny, and there's nothing to be scared about. We have little tiny ones that we use on the face, or that we even use with children. Children with the skin conditions, I feel even more sorry for, because it's just no fair for them. They haven't even gone through the stresses of life yet. So if you have any questions about today's show or how herbs and acupuncture can help psoriasis, please do give us a call or email us. You can check out other shows that we've done on YouTube or the olelo.org website, or visit our website to learn more. Thank you so much for joining us today, and until next time, mahalo.